Stomach cancer. The best treatment options. The stomach is a hollow organ that liquefies food and is part of the digestive system. Cancer is the growth of abnormal body cells. Stomach cancer cells spread by breaking away from other cancer cells and go into the bloodstream or lymphatics, while others penetrate into organs near the stomach. Although the cause of stomach cancer development is not known, risk factors include inflammation of the stomach, Helicobacter pylori infection, smoking, poor diet, obesity, lack of physical activity, and the history of stomach cancer in the family. The symptoms of stomach cancer may include discomfort and/or pain in the stomach, nausea and vomiting, weight loss, difficulty swallowing, vomiting, blood in the stool, and feeling full or bloated after a small meal. Stomach cancer is diagnosed by a physical exam, medical history, endoscopy, and biopsy of the tissue. Stomach cancer is staged according to where the cancer's found and how far it has invaded the stomach tissue, or if it has spread beyond the stomach and into other organs. The treatment of stomach cancer depends on the size and location of the tumor, the stage of the disease, and the patient's general health. Surgery is done to remove cancer tissue. In general, two procedures are common: partial gastrectomy and total gastrectomy. Chemotherapy is the use of drugs to kill cancer cells. It may be used before or after surgery. Radiation therapy uses high-energy rays to kill cancer cells. It is used frequently along with chemotherapy. Many doctors recommend getting a second opinion before starting treatment. This article provides contact phone numbers to several institutions that can help find a doctor to give a second opinion. Good nutrition after stomach surgery may require supplements like vitamins and minerals, plus changing your eating habits. Surgery, a stent placement, radiation therapy, and laser therapy are treatment options for cancers that block the gastrointestinal (GI) tract. Tests to rule out recurrence of cancer, complementary and alternative medicine should be discussed with your doctor. There are support groups for cancer patients. Contact information is listed. Contact information for joining clinical trials is also included in this article. The stomach is a hollow organ in the upper abdomen, under the ribs. It's part of the digestive system. Food moves from the mouth through the esophagus to the stomach. In the stomach, the food becomes liquid. Muscles in the stomach wall push the liquid into the small intestine. The wall of the stomach has 5 layers. Inner layer or lining, mucosa. Juices made by glands in the inner layer help digest food. Most stomach cancers begin in this layer. Submucosa. This is the support tissue for the inner layer. Muscle layer. Muscles in this layer contract to mix, squeeze, and break up the food. Subserosa. This is the support tissue for the outer layer. Outer layer. The outer layer covers the stomach. It holds the stomach in place. Stomach cancer spread. Cancer begins in cells, the building blocks that make up tissues. Tissues make up the organs of the body. Normally, cells grow and divide to form new cells as the body needs them. When cells grow old, they die, and new cells take their place. Sometimes, this process goes wrong. New cells form when the body does not need them, and old or damaged cells do not die as they should. The buildup of extra cells often forms a mass of tissue called a growth, polyp, or tumor. The types of cells making up the tumor determine how the tumor will behave. Tumors in the stomach can be benign, not cancer, or malignant. Benign tumors are not as harmful as malignant tumors. Benign tumors are rarely a threat to life. Can be removed and usually don't grow back. Don't invade the tissues around them. Don't spread to other parts of the body. Malignant tumors may be a threat to life. Often can be removed but sometimes grow back. Can invade and damage nearby organs and tissues. Can spread to other parts of the body. Stomach cancer usually begins in cells in the inner layer of the stomach. Over time, The cancer may invade more deeply into the stomach wall. A stomach cancer can grow through the stomach's outer layer into nearby organs, such as the liver, pancreas, esophagus, or intestine. Stomach cancer cells can spread by breaking away from the original tumor. They enter blood vessels or lymph vessels, through which they can travel to all the tissues of the body. This process is called metastasis. The cancer cells be found in lymph nodes near the stomach. The cancer cells may invade or attach to other tissues and grow to form new tumors called metastases that may damage those tissues. Risk factors and causes of stomach cancer. When you're told that you have stomach cancer, it's natural to wonder what may have caused the disease. But no one knows the exact causes of stomach cancer. Doctors seldom know why one person develops stomach cancer and another doesn't. Doctors do know that people with certain risk factors are more likely than others to develop stomach cancer. A risk factor is something that may increase the chance of getting a disease. Symptoms of stomach cancer. Early stomach cancer often does not cause symptoms. As the cancer grows, the most common symptoms are discomfort or pain in the stomach area, difficulty swallowing, nausea and vomiting, weight loss, feeling full or bloated after a small meal, vomiting blood or having blood in the stool. Most often, these symptoms are not due to cancer. Other health problems, such as an ulcer or infection, can cause the same symptoms. Anyone who has these symptoms should tell their doctor so that problems can be diagnosed and treated as early as possible. Stomach cancer diagnosed. If you have symptoms that suggest stomach cancer, your doctor will check to see whether they are due to cancer or to some other cause. Your doctor may refer you to a gastroenterologist, a doctor whose specialty is diagnosing and treating digestive problems. Your doctor will ask about your personal and family health history. You may have blood or other lab tests. You also may have physical exam. Your doctor feels your abdomen for fluid, swelling, or other changes. Your doctor also will check for swollen lymph nodes. Endoscopy. Your doctor uses a thin, lighted tube, endoscope, to look into your stomach. Your doctor first numbs your throat with an anesthetic spray. You also may receive medicine to help you relax. The tube is passed through your mouth and esophagus to the stomach. Biopsy. An endoscope has a tool for removing tissue. Your doctor uses the endoscope to remove tissue from the stomach. A pathologist checks the tissue under a microscope for cancer cells. A biopsy is the only sure way to know if cancer cells are present. These are the stages of stomach cancer. Stage 0, the tumor is found only in the inner layer of the stomach. Stage 0 is also called carcinoma in situ. Stage I is one of the following. The tumor has invaded only the submucosa. Cancer cells may be found in up to 6 lymph nodes. Or, the tumor has invaded the muscle layer or subserosa. Cancer cells have not spread to lymph nodes or other organs. Stage 2 is one of the following. The tumor has invaded only the submucosa. Cancer cells have spread to 7 to 15 lymph nodes. Or, the tumor has invaded the muscle layer or subserosa. Cancer cells have spread to 1 to 6 lymph nodes. Or, the tumor has penetrated the outer layer of the stomach. Cancer cells have not spread to lymph nodes or other organs. Stage 3 is one of the following. The tumor has invaded the muscle layer or subserosa. Cancer cells have spread to 7 to 15 lymph nodes. Or, the tumor has penetrated the outer layer. Cancer cells have spread to 1 to 15 lymph nodes. Or, the tumor has invaded nearby organs, such as the liver, colon, or spleen. Cancer cells have not spread to lymph nodes or to distant organs. Stage 4 is one of the following. Cancer cells have spread to more than 15 lymph nodes. Or, the tumor has invaded nearby organs and at least 1 lymph node. Or, cancer cells have spread to distant organs. Treatment for stomach cancer. The choice of treatment depends mainly on the size and location of the tumor, the stage of disease, and your general health. Treatment for stomach cancer may involve surgery, chemotherapy, or radiation therapy. You'll probably receive more than one type of treatment. For example, chemotherapy may be given before or after surgery. It's often given at the same time as radiation therapy. You may want to talk with your doctor about taking part in a clinical trial, a research study of new treatment methods. Clinical trials are an important option for people at any stage of stomach cancer. You may have a team of specialists to help plan your treatment. Your doctor may refer you to a specialist, or you may ask for a referral. Specialists who treat stomach cancer include gastroenterologists, surgeons, medical oncologists, and radiation oncologists. Your healthcare team may also include an oncology nurse and a registered dietitian. Your healthcare team can describe your treatment choices, the expected results, and the possible side effects. Because cancer therapy often damages healthy cells and tissues, side effects are common. Before treatment starts, ask your healthcare team about possible side effects, how to prevent or reduce these effects, and how treatment may change. Your normal activities. You and your healthcare team can work together to make a treatment plan that meets your needs. Surgery. The type of surgery for stomach cancer depends mainly on where the cancer is located. The surgeon may remove the whole stomach or only the part that has the cancer. You and your surgeon can talk about the types of surgery and which may be right for you. Partial gastrectomy for tumors at the lower part of the stomach. The surgeon removes the lower part of the stomach with the cancer. The surgeon attaches the remaining part of the stomach to the intestine. Nearby lymph nodes and other tissues may also be removed. Total gastrectomy for tumors at the upper part of the stomach. The surgeon removes the entire stomach, nearby lymph nodes, parts of the esophagus and small intestine, and other tissues near the tumor. Radiation therapy. Radiation therapy, also called radiotherapy, uses high-energy rays to kill cancer cells. It affects cells only in the part of the body that is treated. Radiation therapy is usually given with chemotherapy to treat stomach cancer. The radiation comes from a large machine outside the body. You'll go to a hospital or clinic for treatment. Treatments are usually 5 days a week for several weeks. Side effects depend mainly on the dose and type of radiation. External radiation therapy to the chest and abdomen may cause a sore throat, pain similar to heartburn, or pain in the stomach or the intestine. You may have nausea and diarrhea. Your healthcare team can give you medicines to prevent or control these problems. It's common for the skin in the treated area to become red, dry, tender, and itchy. Nutrition after stomach surgery. A registered dietitian can help you plan a diet that will meet your nutrition needs. A plan that describes the type and amount of food to eat after surgery can help you prevent weight loss and discomfort with eating. After stomach surgery, you may need to take daily supplements of vitamins and minerals, such as vitamin D, calcium, and iron. You may also need vitamin B12 shots. Some people have problems eating and drinking after stomach surgery. Liquids may pass into the small intestine too fast, which causes dumping syndrome. The symptoms are cramps, nausea, bloating, diarrhea, and dizziness. To prevent these symptoms, it may help to make the following changes. Plan to have smaller, more frequent meals. Drink liquids before or after meals. Cut down on very sweet foods and drinks. Ask your healthcare team if they can suggest medicine to control the symptoms.